Okay, madam. Start here.
Okay, Mihir, started, Mihir.
Yes, madam. Start.
Okay, good evening, dear students. A warm welcome to all to the sixth and final module of the PG training program of this season. So now this PG training program is over, and next I'm sure all of you will come out in flying colors. So what next is a big question. And to give you all an answer, choices, and a guidance, today we have here with us the dynamic, vibrant, and the master brain of all Cochin Ophthalmic Club activities, the one and only one, Dr. Gopal S. Pillai. A big round of applause. എല്ലാം മ്യൂട്ട് ആയതുകൊണ്ടാണ് അപ്ലോസ് കേൾക്കാത്ത കേട്ടോ. Dr. Gopal is a professor and HOD of Amrita Institute of Medical Sciences, Kochi. Warm welcome, Dr. Gopal.
Thank you very much, ma'am. Thank you.
Friends, once again, make it an interactive session. Clarify all your doubts about your future plans and ventures in ophthalmology. Let us also welcome Dr. Mohammad Swadik, Medical Director, Al Salam Eye Hospital, to moderate this session.
Thank you.
Now, a small piece of advice to my dear students. Once you have started practice, never ever ignore the complaints of a patient. Always try to get an answer. Now, if you have some doubt, you can ask your colleague or get an opinion of your senior. There is no ego. So always get an answer to it. And never hesitate to do it also. Above and all, you should all be a good human being. Should be kind, courteous, and never lose heart. Now we are seeing in the media lots of things happening. So never lose your heart, because something happens to a family which is going to lose. And without being a good human being, all this education is of no value also. And now to Dr. Mihir, the Treasure KOS. And thank you, Dr. Mihir, from all of us for conducting these PG modules so wonderfully and so smoothly. Thank you, JKOS.
Thank you, Dr. Vijayalakshmi. So, good evening all, and welcome to the sixth module of our sessions, PG sessions. So, one of the major dilemmas that youngsters of our fraternity face today is how to climb upwards in their careers. The first major decision-making point in your career is just after your post-graduation. The choices you make at this important juncture of your life will decide how your future is going to shape up. So you have to choose wisely now if you want to be happy later on. And to help you all make the right decision, we have with us today Dr. Gopal Pillai, who is a professor and head of Department of Ophthalmology and Chief of Vitreoretina at Amrita Institute of Medical Sciences, Cochin. Dr. Gopal did his post-graduation from All India Institute of Medical Sciences, Delhi. He was admitted as Fellow of FICO in 2002 and FRCS in 2003. He has done his fellowship at McMaster University, Hamilton in 2009 and American Academy Certificate course on AMD in 2011. He is a member of the National Diabetic Macular Edema Task Group and a member of the National Optometry Curriculum Development Task Force. He is a reviewer of the Journal of American Academy of Ophthalmology and the Journal of Tropical Medicine and also the Saudi Arabian Journal of Ophthalmology. He was the past editor of KJO and he is currently also the secretary of COC. He has more than 30 international presentations, 300 national presentations, 10 international publications, and 4 book chapters to his credit. He is also the pioneer of 25 gauge sutureless retinal surgery in India. So welcome, Dr. Gopal. To moderate today's session, we have with us today another eminent clinician and academician, Dr. Mohammad Swadik, who is Medical Director of Al Salama Group of Hospitals. He is also examiner to the Royal College of Physicians and Surgeons of Glasgow for FRCS Part 3 examinations. He is also approved guide for clinical research at University of Edinburgh, UK, and is also preceptor to the Salus University, Philadelphia, UK. I welcome Dr. Swadik, and I invite Dr. Swadik to take over this session. So over to Dr. Swadik.
Thank you, Dr. Mihir, for the introduction. Thank you, Dr. Sujit and team for arranging this wonderful teaching program. Dr. Gopal, I would like to invite Dr. Gopal to start the session.
Thank you very much, sir. Thank you very much for the kind words, Mihir. And thank you, Vijayalakshmi Madam and Sujit and Kozhikode Ophthalmic Club for inviting me over. And thank you, postgraduates, for attending in these large numbers. First of all, let me congratulate you for selecting ophthalmology as your bread and butter, as your companion for life in terms of a job is concerned. Can you see my presentation?
Yes.
Yes.
Yeah. So we have to choose wisely to live happily. This is what the theme is today. So maybe in about the next 30-35 minutes, or it's 6:10, by about 6:40, we should be basically looking at what to do now after post-graduation, a little more objectively, with a little more information. So first of all, let me introduce this term to you, ophthalmonomics. Okay, because you see, when the senior people around in this particular room were juniors like you, the situation was not like this. We were not, we were basically doctors who would treat patients, and patients would be happy, they would be thankful, things like that. Things completely changed. And now you see, we are a people who provide a service, and patients are actually clients who come in for getting the service. As Vijayalakshmi Madam said some time back, you have to be mentally strong. You have to be professional in your approach. We don't think that doctors are gods and we are doing this, doing that, nothing like that. You have to be very professional. And in this, we should, as I said, I'm congratulating you because health dynamics wise, ophthalmology is a very, very great branch. If you have to start a hospital, the number of healthcare providers in a hospital is very important. Like, for example, in a cardiac center, you should have the cardiac cardiologists, the cardiac surgeons, the cardiac anesthetists. If there's a pediatric cardiac medical team and surgical team, there should be ICU, there should be, you should understand the amount of healthcare providers that you require to run a critical unit. So it's hugely a teamwork. And if you see any one person in the team is not performing adequately, like for example, a sweeper who sweeps the floor in the ICU, he with that particular hands touch the patient, an infection can be transmitted. That is the problem of a large team, which ophthalmology does not have. What is the infrastructure requirement in a cardiac surgery or a gastrosurgery or a transplant situation versus ophthalmology? It is much lesser. So teamwork, it's important everywhere, but the team that an ophthalmologist needs to manage is not a large team like in a general hospital. The overheads, you can plan your overheads depending on the infrastructure that you want to decide. And are the results predictable? In our situation, cataract surgery has almost the most predictable results in the whole world. And any fair surgeon can give about 6/6 results. It's not that, the best surgeon can only give 6/6. A reasonably good surgeon with practice and experience can give very good results. So you don't see, if you're not very good, don't take the more challenging cases. That's all in life. Okay. So if you are the best surgeon, yes, you can take the small pupils, you can take the hard cataracts, you can take the uveitic eyes, everything. But if you are not that good, you have to have that insight, first of all. If you have that insight, then your predictability is going to be really good. Numbers means numbers in terms of the number of patients. In a neurology or what are the other OPD intensive specialties? There is cardiology. There is cardiology is more of a procedure dependent. Neurology is there. Then internal medicine. See, the time required to actually evaluate a patient history is so important, and then examine the patient, and the time spent over a patient who is admitted to come to a diagnosis and then manage that is enormously high. Okay, I'm talking about a very good doctor. See, there are people who can see 150 patients in 3 hours or 4 hours. That is there, but that is about disposing the OPD. That is not treating a person. I believe that you have to give time, like the communication has to be good. First of all, you have to hear what the patient has to say. That's a very, very important thing. And then you have to diagnose him based on your history and clinical examination. And then see, in 1 second, you will know what is the diagnosis. Once you are little experienced, in 1 second, 2 seconds, maybe 5 seconds, you will know what is the diagnosis. But the question is whether the patient can perceive that particular diagnosis. That's a very important thing. So that communication to the patient so that he understands the diagnosis and he understands the treatment is our challenge. That may take maybe 5 minutes for one person, maybe 10 minutes for another person. But even then, numbers are our forte. We can see many number of patients in the OPD. And if you see any eye hospital versus general hospital, the number of patients who queue up in an eye hospital are very, very high. So numbers are our strength. I always say, how many people, like if there are 1,000 people, how many will require a cardiac surgery? Maybe one person. How many people will require an orthopedic surgery after falling down? Maybe 15 people, 20 people. How many people will require cataract surgery? Every single one of them will require 2 cataract surgeries. So you see, we have the advantage of numbers and good outcomes and happy patients. That's a very important thing. Like neurosurgery, whatever great thing that they do, like in retinal surgery, see, our outcomes are not as good as some of the other surgeries in which there are lots of good outcomes and very happy patients. So whenever there is a good outcome and happy patients, that doctor is a good doctor as far as society is concerned. In that count also, ophthalmologists reign high. So as I said, in job market, how many eye hospitals are there? Any other standalone hospitals in the other disciplines? Absolutely not. So disease market as well. I told you already about the disease market. I now told you about the job market as well. Remuneration wise, you see, how many surgeries can a cardiac surgeon do in a day? Maybe 2, maybe 3. How many can a orthopedic surgeon do? Maybe 4, 5. How many surgeons can a cataract surgeon do? Some of the good cataract surgeons are doing somewhere around 60 or 70 cases a day. And some of the very busy people are even touching 100. So that is the numbers advantage that we have. And there's a joke that the cardiac surgeon or one of the transplant surgeon makes a lot of money, but ophthalmologist makes a lot of money and has time to play golf. So that is what ophthalmology is all about. We get free time. And that is why I want to congratulate all of you who have taken up ophthalmology. And if you want to counsel any of your juniors to take up something, you say, ophthalmology is really great. You take ophthalmology. Like in Mumbai, the top ranks, in Delhi, the top ranks, they will take ophthalmology. In Kerala, even now, people take radio diagnosis and they want to, speak to computers. All right. So PG training, I would believe that, you would be adept in diagnosing, investigating, and managing almost all cases. Not all cases, but almost all cases you would have observed people managing it. But actually, is it so? There is, are you able to surgically manage pterygium or medically or surgically manage corneal ulcer, cataract, glaucoma, DCR, simple plastic surgery, at least horizontal squint, medical retina, and LASIK? These are the, basic things that a person should be adept when he is starting. But, there's always an expectation reality mismatch. And as a doctor, we should also, whenever we are talking to a patient, he would come to you with this expectation. This is my expectation, doctor. And your expectation will be like here. Okay. So this expectation reality mismatch has to be solved. And that is a very important part of communication. And probably I will try to do that And you should always look at this particular thing. Guy is having long hair, but people will be thinking that it is this guy, whereas final reality is that is this guy. Okay. So decisions, confusions. This is what happens after post-graduation. And let us look at some of these things. Let me tell you that there are some biases. Okay. All of you will have some role models, one of your teachers, one of your senior colleagues. Maybe he's your father or mother who is an ophthalmologist. Maybe one of the neighbors or one of your relatives, or the doctor that you went for your checkup. So you will have role models, and you tend to think that, I want to emulate that particular person. Okay. So you should understand that, your life is your own. And it is.
All please unmute yourself, please.
Not unmute, mute.
Sorry, mute yourself, please.
Yeah. Okay. Sujit, I think you should do it. Yeah.
I just
so
missed that.
If I am unmuted, if I am muted, I will unmute myself. Okay. So these role models may be specialists and super specialists. They may be academic giants. They may be jack of all trades. They may be a money minters. They may be an entrepreneur. So his life is his own. See, you cannot just, think that that life is the best. Grass is always green on the other side. So sometimes the academic giant may be crying every night that, I am not having a good day's sleep. Maybe the money maker will not be able to spend that money because he's so busy. The entrepreneur may be so busy, he cannot even take one day's leave because his center, he has to give EMIs. So don't think that grass is always green on the other side. And role models are very good in your initial phase of life. But when you finally pick up your own sphere in which you're going to work, it's your wish that matters. So this is one important bias that you can have. So you have to stop and think and decide to choose what life you want to do. That is the first thing that you have to understand. Nobody, but I can inform you, these are the pros, these are the cons. You can take what you like. Definitely, all of you won't get what you actually like, but then you will like what you get also. But it should not be a huge disparity. That expectation reality mismatch should not be this big. It should be somewhere here. So try to bring the gap as low as possible. So you have to decide. Now, what are you deciding? Okay. So the first thing that you have to do is you will want to think what you want to do 20 years from now. 20 years from now, like I was your stage about 20, 23 years back, 23 or 24 years back. Now, the point I am here, so I had to think in my mind 20, 25 years back, what I wanted to do at this point of time. Maybe at about 45 or 50, what do you want to do? But 45 or 50, what you are doing, probably you will be doing that for the rest of your life. Okay. So where do you want to be? There are a lot of where and what and all those things. Where do you want to be? Would you want to be near your home? Would you want to be in a metro? Would you want to be in a rural setting? Would you want to be out of India, the Gulf, the Middle East, or UK, USA, Europe? Where do you want to be? That's an important question. Or do you want to be near your parents, or your husband's house, or your wife's house? What is it? Then we have to find out what is the job market there. Okay. Whether you want to be in your own practice, or on a job, or academics, or do you want to do a startup? What is it that gives you joy? Probably you would not know that right now. Probably you could start with one or the other and see how things are over a period of time. You don't have to decide on this overnight. Right now, we don't have to decide. Probably your job, whatever you want to do is basically in a transition, in a change, but be on the lookout. Look out as to what gives you joy and what is your passion. What does your heart tell you that you have to do this or do you have to do that? Then you should have your own, you should know your own strengths and weaknesses. What are you good at? What are you not good at? That's something that you need to know. I have basically asked some of the people to write down on a piece of paper, what are you good at and what are you not good at? You have to work on your weaknesses and you have to work at your strengths. Will a fellowship get me where I want to go? That's an important question, because a fellowship is an investment in time after post-graduation. Is money the most important thing? So that is also an important question. Some people want money, but money may not be the most important thing. Is free time with family more important than all other things? So these are questions that you have to sit and answer. You have to think and answer, not on one day, probably when you are on a work, maybe over a year-long period, and decide what is it that gives you happiness and what do you want to do 20 years from now. And it depends on where. Yes, the country mouse or the town mouse. Probably you want to be in the countryside, or do you want to be in the metro? Okay, all this is an important decision. Okay, now let us come to each of the individual things. Private practice, or friendly neighborhood clinic. Okay, so if you want to start a friendly neighborhood clinic, your house is there, you have lived there for 30 years or 25 years now. Yeah, for about 25 years now, and you know everybody, and your parents have been living there. So you are a very important person in that locality. You are the doctor. Okay, you can start a friendly neighborhood clinic where all the people who come to you are your uncles and aunties. Should be jack of all trades. It's a very difficult thing, but you should know a little of everything. Fellowship helps to market you, but probably if you're in a small place, your own place, fellowship is not needed, because it's not through fellowship that people comes to you, it's by acquaintance. Whereas if you are not in your own locality, you're moving somewhere else and starting, then the fellowships, the degrees, the trainings, all those have an impact on the patient. That is important. Okay, generalization gives you more cases. If you are a general ophthalmologist or a comprehensive ophthalmologist, I can see anything, more cases will come in. If you're a specialist, like you did a fellowship and then you are starting a practice, probably you have to do a multifocal practice. You have to go to this place for some time, you have to go there for some time, because one particular location gives you only that much practice. And as I said, ophthalmology, you have got a lot of time to see. So unless your practice in one particular place itself keeps you busy the whole day, you can do multifocal practice. But generally, it's important not to operate in multiple locations. Generally, you think that, which is the best theater where I can operate and things like that. That is practice, private practice. Job, okay? Job is an important thing. Some people like to have a job. Some people don't like to have a job. They want to be masters of themselves. Fellowship is always a good start. After post-graduation, if you want a job, a fellowship is a good start, because, you will be a little more valued. Without fellowship, what happens usually is there are a lot of corporates who offer an OPD job. Okay, OPD job is very good because you just sit in the OPD, you see the number of patients, you find out the cataracts, and then you refer the cataracts to the cataract surgeon. He will operate, and they will give you the money depending upon the number of cases that you refer to the cataract surgeon. And sometimes you may be given the best doctor award if your number of referrals are very high. They may not like you if you do not refer a lot of patients for cataract. So it's an OPD doctor who is a triaging traffic policeman, who basically sends the surgery here, medical retina there, squint there, pediatric ophthalmology there, plasty here types. So without fellowship is an OPD doctor. I'm not telling, see, nothing is, let me tell you, let me be very plain. Nothing is bad. Everything is good. Okay, it depends upon what you want to do. And I don't believe in my mind that somebody who is sitting in the spectacle shop as a doctor is any less than the biggest, entrepreneur running 100 cataract surgery per day center, because he is doing what he is liking, and he is doing what he is liking, or his role. Okay, so nothing is bad or nothing is too good or anything like that. You have to choose. That's all. Okay, so if it is OPD doctor that you choose, this is your work. Probably you will be a triaging person. The problem with an OPD doctor is, okay, let us think that the OPD doctor is paid 1 lakh to start up with. Very good. After PG, I get 1 lakh. Maybe it's dropped down a little bit now. I think there are some entrepreneurs here in these groups who they may be able to tell you better about that. So After 4 years, 5 years, 6 years, there's a new PG knocking at the door. Okay, new person who just finished PG. He says, I can work for half that much. The entrepreneur will think, what is the need for keeping this guy whose basic job is triaging? I can keep the other guy. So if you are just an OPD doctor, your value will reduce over time. That is what happens to the IT industry. Okay, in an IT industry, about 6 years or 7 years after getting into the job, he becomes stale. A newcomer can do much more, he knows much more technology than the six-year-old. As doctors, we are not like that. As we grow older, we learn a lot of tricks of the trade, including talking to the patient, communicating, diagnosing, referring to the correct place, understanding which patient to touch and which patient not to touch. All these things are basically done after burning your hands. And that is what is called experience. And there is no, shortcut to experience. And that is why most of these entrepreneurs also prefer, older guys who have a lot of experience, because they know how to handle patients, not clinically, non-clinical management, psychological management, making them satisfied. That is also very important in our specialty. Okay. So without fellowship is OPD doctor, depends upon what one wants and type of hospital. There's a different workflow in a corporate versus academic versus a small eye hospital, medium eye hospital, like that. Okay. Let's go to a job in a corporate hospital. Okay. A typical corporate hospital works on a low volume, high cost system. Okay. I'll tell you about low volume and high cost. Okay. Let us think that this guy operates 3 cataract surgeries. Let me tell you that Aditya Jyot Eye Hospital in Mumbai has Natarajan, S. Natarajan, one premium retinal surgeon. His consultation fees is 5,000. And if somebody has to see him, they have to do a fluorescent angiography, ICG, OCT angiography, and then with the reports only he can be seen. So you understand, to see that person, you have to spend about 20,000 rupees. That is a low volume. That is a low volume, high cost system. Now the low volume will slowly keep on moving up, high volume. So then what they will do? They will hike up the costs further, so that again, volumes will become a little low. So the basic idea is, in a lower volume, you will be able to have more chair time with the patient, and you will be able to make them more satisfied. You will be talking to, in Mumbai, they will be talking to most of the film stars or, dons of the underworld, or I don't know. So you have to have a lot of, personalized treatment for those people. So that is a typical low volume, high cost system. All our VIPs, and handling VIPs is very, very difficult job. And there will definitely going to be a high, we are not talking about an entrepreneur corporate, we are talking about a job in a corporate. So there will be a high take home, but definitely you'll have to take your work home. Your mobile rings at 12 o'clock because he has some itching in the eye. And then you have to very nicely explain to him that this itching of the eye is a big disease which occurs when you do this, and you have to treat it like that. And at 11 o'clock or 12 o'clock, you'll have to explain that to that VIP. Now you can follow the lifestyles of the rich and the famous, but there are going to be performance targets and pressures. And absolutely, let me tell you that as doctors, we do not have much social security. Even the lowest paid IT personnel in the IT industry or the engineers, they are given the insurance, their parents' insurance. That's part of the job contract. Whereas most of the hospitals which employ doctors don't provide any social security. Okay, and non-clinical mistakes, they are really unpardonable. These are all VIPs, and if you lose your cool, you shout at them, or you do something which they don't take it in good taste, they become unpardonable for a corporate. Okay, what about a medium-sized eye hospital? Okay. Many times what happens is proximity will be there, because a medium-sized eye hospital will be there near your house somewhere, maybe within 5 kilometers. So you will be eyeing at that particular hospital. There will be 1 or 2 doctors there. Maybe you can be the third doctor there, or somebody is starting one. Can I also join? So that is a job in a medium-sized hospital. They will have reasonably good facilities. I don't think they will have the best of facilities, but they will have reasonable facilities. There will be a lot of flexibility in terms of time, in terms of leaves, because it's not a very professionally run hospital. Probably it's one doctor who started it or something like that. Unless he has hired an MBA person who looks into all that. Usually doctors are not good managers, and they usually go according to emotions and all. There are exceptions, obviously. There are doctors who are really good managers as well. I'm telling in general. Okay. Now in a medium-sized eye hospital, again, it will be an OPD doctor versus a surgeon. Okay. An OPD doctor will sit in the OPD full time, and he will refer the doctors to the other doctor probably in that hospital in which he will be operating. So you are a feeder to him. Maybe that surgeon requires 2 feeders, 3 feeders, 4 feeders, depending upon his speed of surgery and his expertise. Generally, in a medium-sized hospital, you should be happy and content with that. No academic growth, probably no great economic growth. Again, no social security. If another hospital, mid-sized hospital, starts just opposite to him, then probably the number of patients will come a little lower, maybe 50-60%. So that economy may be a little slower. So they can't increase the charges very rapidly, like in a corporate, a large corporate or something like that. So that is again another problem. So no gross growth will be there. No big social security will be there. Now your boss, the medium-sized hospital, if he decides to sell the hospital because of something, or if he takes ill or something like that, maybe he will shut down shop. So there's no social security in terms of continued job or anything like that. And it is always boss centric. You have to please the boss in order to be a good worker in that particular institution. And in about 2 or 3 doctors or 4 doctors, small mid-sized hospital, the boss is always right, and you have to be in his good books all the time. And always there is an initial honeymoon and some late problems because there will be some ego issues, etc. coming in. So these are the pros and cons in a medium-sized hospital. What about a spectacle shop? It's a primary care. Okay, so spectacle shops are places where people are not even coming with a problem in the eye. They are primary care. You are a screener. Okay, so there are people who have joined eye spectacle care because they want flexible timings, flexible salaries. There are people who join multiple spectacle shops. 2 hours in the morning, 2 hours in the afternoon, 2 hours in the evening, 2 hours in the night. 4 spectacle shops are covered. You get good money without any risk. Okay, so 8 hours work and a lot more money than most of the other guys, but you are in primary care. Some people don't like to be in primary care. They're always quaternary and tertiary care, as that's really great. I am in primary care. But some other guys are there who are all right with primary care. It's okay. I will pick up a lot of people. I'll talk to a lot of people. That is what we would think. So it can be an add-on to your practice. Sometimes what happens is there will be a practice for you or a small job somewhere else. And on the way home, you reach this particular spectacle shop, spend some time there. Job satisfaction per se for the effort that you've taken during your post-graduation to actually master a lot of things, that would be a little poor. There is no growth again, not much growth. And there may be targets at some shops. Basically, you have to have this many spectacles per day, etc., etc. Now, coming to government hospitals, it's through Public Service Commission that they take in. So the numbers are a little limited, and you can work for a lot of poor and needy people, and pay is not dependent on the quantity of work that you do. Mostly in the corporate world, as well as in the eye hospitals and all, your work, the quantity of work actually decides the pay. The quality of work doesn't have so much of importance on the pay. The quantity of work decides on the pay. The quality of the work is what brings you more patients. Quantity of the work is what brings you the paycheck. So here, your pay is not dependent on the quantity of work. You will get good job satisfaction if you are in a place where enough facilities are there. And yes, there will be frequent transfers from one place to the other. So there are some hierarchical elements in it, and there will be sometimes political interference, media coming in. One guy is there who came to you. There are 100 people waiting, and he wants preference because I am this man's this man. So that will be there, and that may play in your head. You may lose school. It may create an unnecessary ruckus, etc. Infrastructure and facility is definitely improving. Like we have a lot of hospitals in which medical retina facilities are there. Surgical microscopes and phaco machines are there in almost all district hospitals. They are sending people for training. DNB teaching has started in some of the district hospitals. So it's very, 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 very good. Government medical colleges, many of you may aspire to be government, to be, senior residents or assistant professors or even professors at a later stage in a government medical college, because you've all studied in some of these medical colleges, and your role model as far as your mind is concerned may be a professor, maybe this person who taught me, or this person who caught my hands and did this surgery, taught me the surgery. Okay, that will help fulfill the teacher within you. You'll get good clinical work. Facilities in medical colleges are really improving. Like when I finished retinal surgery and came here to Kerala, I wanted to join medical college, but I thought that, none of the medical colleges had a full-fledged retinal surgery setup. So I would be wasting whatever I studied if I joined some place with that. That was the thought process at that point of time. So, but now you see facilities are improving in a lot of good medical colleges. A lot of colleges are having, all the systems in place. Very good. The most advanced OCTs, the most advanced machines. I think Calicut Medical College has a LASIK center as well. Okay. So facilities are definitely improving. You get a satisfaction of treating poor and needy. And again, pay is not linked to the quantity of work. So that's a very important thing. That gives you a lot of social security. Now, let me think that my right hand starts shaking. I cannot do surgery, right? So my social security is zero. Then that means my take home will significantly reduce. Okay. Whereas in a government medical college, in a government hospital, nothing will change. Nothing will change. That is a social security that you have if you are in the government at this point of time. You can work more, you can work less. So unless, there are some unit chiefs and HODs who are very factitious about certain things, that you have to come at 8, or you can leave only by this, you have to do this, you have to do that. There are some HODs and unit chiefs like that. And there are also some unit chiefs and HODs like, don't touch the phaco machine. I am the phaco surgeon, nobody else does the phaco. Slit lamp I'll keep in lock and key. So those different types of unit chiefs and HODs are under, and definitely you are under those people. So that is there. That hierarchy is there in the government, which you cannot take out. And yes, political and media interference will be there. Right now, you saw in Trivandrum, the COVID in charge doctor got suspended for a reason which is not particularly hers probably, but those are the problems that you have to come across. And yes, transfers. Like, about 10 or 15 years back, there were only 3 or 4 or 5 medical colleges. Okay, so transfers means not so many. But now, since the number of government medical colleges itself is increasing, you may get transferred to Idiki or a lot of other places. Okay, so that is in government medical colleges. Academic institutions would include medical colleges, universities, very good teaching, eye hospitals, fellowships. Definitely in such hospitals, you require people who are actually fellowship trained, who have some experience of working in as a consultant elsewhere. And those are the people whom they prefer in the academic background. Fellowship is an important decision that you have to make. So first thing is about, the place of fellowship. There are places in which they offer fellowships to a lot of people, like 12 people in a year or 15 people in a year. But you should understand that these places, the surgical hands-on training for you may be a little less, but maybe a structured training is there. So that means you will have to again invest some time to actually learn surgery. Okay. So there are different things that you have to learn. One is about, diagnosis. And number 2 is about surgery. Okay. So broadly, let us talk about cataract surgery. There's nothing so much significant in the diagnosis of cataract, but cataract surgery fellowship. Now, let me tell you how it has changed over the years. Let us think about one of the large training centers like Aravind. So Aravind, if you join Aravind Eye Hospital as a cataract fellowship trainee, in the first year, probably you will get only SICS. And by the second year, you may be offered phaco in simple cases. But then if you want to do the more complex cases, you have to probably stand again for the third year to do the more hard cataract cases and the small pupils. But even then, they will give you the subluxated lenses only by the fourth year. So they have also learned that, in a surgical evolution of a particular surgeon, they want people to stay there for a longer period of time so that, the trained surgeon can be there who can operate more numbers. So they have also, elongated the course. So years of investment is a very important thing that you have to think in mind whenever you're thinking about a fellowship, in terms of which branch you want the fellowship, or if you want to think about where do you want to do the fellowship. Definitely, in most places, the pay is going to be low. An OPD doctor or a spectacle shop doctor will be getting much more pay than a fellow in an academic institution. Obviously, there will be less time for the family. It's actually great. You're basically a worker. You are still now not a person who is earning. You are learning. Okay, we'll groom you to be a good specialist. But the other flip side of being a specialist is that your job market is narrow. Like I said, when I came back from All India Institute trained as a retinal surgeon, my job market in Kerala was maybe 2-3 centers. That is all. And out of that, 1 or 2 centers already had people. So my job market significantly reduces if I'm a specialist. Even if I super specialize, my job market still again gets narrower. Okay. So then it is about demand versus supply. Okay, there's something called demand and there's something called supply. Now let us think that there are 1,000 retinal surgeries to be done in 1 year. Okay, there are 5 people in Kerala overall. They will die doing the cases. Now imagine the numbers increase to 100. That is supply which increased. So if the supply increased, the 1,000 is not going to increase to 10,000. The 1,000, the population may increase. The people may come. People may become more aware. They may come for surgery earlier. All that will increase the numbers from 1,000 to 1,200, 1,500. But if the 10 numbers of retinal surgeons increase to 100 numbers, then your case per surgeon reduces drastically. And so do the demand of that particular surgeon. So if there are only 5 people managing squint in Calicut, that's fine. There are that many squints in Calicut. There are only 5. So the 5 will be very coveted. But imagine there are about 25 people. Then the demand for the squint surgeon will significantly reduce. The take-home pay will reduce. A lot of that is basically called demand versus supply, something that we have to learn from what happened to nurses. Nurses are a very important, like Kerala had produced a maximum number of nurses, and then they had to strike to get what was due for them, to get at least a decent pay. So that is the power of demand versus supply. And the more specialized you are, the more narrower your market is, and the more rapidly the number of doctors, if it increase very rapidly, you will have more competition. Okay, but if you want to come up as an academician or as a surgeon, a fellowship is a necessity. Academic institutions, if you want to join, you should understand that that's harder work, longer hours. There is a lot of performance pressures, not like the corporate hospital pressure, but publication pressures. How many grants are you getting? And your pay will be definitely linked to your performance. And there will be lower pay packages as compared to the corporate and as compared to the job that you are doing. Okay, so growth in your, but then you will definitely have a lot of growth in your domain nationally and internationally. Okay, that is what you will get. And obviously you will have less time for your family. This is our Amrita data, which tells me BSc optometry, MBBS, MS ophthalmology, retina fellowship. There are publications, presentations, awards, societies, projects, MBBS projects, postgraduate thesis projects, textbooks edited. Now, what are your national recognitions having? So all these will come in, and research will come in. basic research, epidemiological research, drug development, animal research, clinical research in retina, glaucoma, like this. You also get grants of 10 crores. This is 1 crore grant. This is what is the pressure in an academic institution. What about a charitable institution? Okay, charitable institution is also a wonderful type of place that you can work. Basically, there is a lot of hard work, but very rapidly you can move up the surgical ladder. There will be definitely lower pay and probably your social status in terms of you'll be traveling into camps, one camp, then the other camp, difficult terrain, all those things, but reach surgical zenith very fast. And that can give you confidence. And obviously working in a charitable institution, you can count your blessings because you've done a lot of good job for a lot of people. What about an entrepreneur? Okay, if you want to be an entrepreneur, first of all, you have to be broad-based. You should know how to manage this, and you should know how to manage that also. You should be a reasonably good trained cataract surgeon who knows a bit of medical retina, who can talk to people some sense. You can have then you can add on. See, you cannot be all at one. Definitely not at this point of time. Maybe 25 years back that was possible, 20 years back that was possible. But at this point of time, you cannot be master of all trades. But there are a lot of people who combine cataract surgery, medical retina, refractive surgery, etc. But pediatric ophthalmology, definitely your spectacle practice as an entrepreneur is a very, very important thing. So don't undermine refraction. And you have to basically look at which is your place of startup. Your own center is like you are your own master. Okay. The thing that you have to decide is how big it should be. It should be, can it be just a clinic? Small clinic where I see the OPD patients and generate my surgeries, and I will go to play hospital A for surgery or hospital B for surgery. What all should it cater? What are the HR needs? How big it is will decide the HR needs. And one of the most important thing is its location. Where should it be located? Should you just have it near your home? If you are having it near your home, you'll have to give free treatment to all your near and dear. What is the market around? Yeah. So you should know your market around. And what is your, can you hear me now?
Yes, sir.
Yes.
Yeah. What is the market around? What is your USP? Who will finance you? Are you going to be your own financier, or are you going to find a financier who will invest for you, but who is going to ask you what are the returns on a yearly basis? So market around and location, I would just like to say that, location is a very important thing. If you are in a metro versus if you are in a rural area, if you are in a setup in a rural area, your rents are going to be much lower. Your costs for that are going to be lower, and you're going to be getting the surrounding people. A metro will give you more people from, your referral base is going to be much larger. Okay, you have to decide your USP, who will finance you, and how will you realize the investment. Again, you can decide on high volume, low cost, or low volume, high cost as you want it. Okay, that is something that you can decide. If you take the government programs like the RSBY or the Ayushman Bharat as it is coming, probably that will be a low cost but high volume setup. Whereas if you are planning to do your cataract surgeries at about 35,000 or 40,000 or 50,000, then you can afford to have a lower volume but with higher costs. Group practice is again another important thing. Okay. You can have this group practice is something which is coming in new, which is taken USA and other developed areas by storm. It's an own and share facilities. Multiple people invest together so that there are less responsibility and less headaches, less overheads. But then you are on your own master. But there's a very, very important thing that you have to do. You should have very good interpersonal relationship. You should have good understanding friends. Some of the best friends who started together have broken apart and become bitter enemies, basically because, as the center grows, there's a lot of ego, there's a lot of competition among friends. If it is the same specialty friends, they will compare his number of surgeries versus his number of surgeries, more earning versus less earning friends, aggressive versus submissive friends. All these problems come in a group practice. But with all this, there are a lot of people who are doing excellent group practice, like one cataract surgeon, one retina person, one pediatric ophthalmologist, one refractive surgeon, one or two general comprehensive ophthalmologists joining together to invest on a place in which anybody can come and do surgeries. That is one very good model for the future. But again, you should know what gives you joy and sorrow. Is it about doing the surgery, or is it about talking to people and patients? Less job and more free time. Is it about having more patients in your place, or is it complex case solving, or is it about, are you a medical sort of internal medicine sort of a doctor who looks at uveitis and tries to find out what medical problem the person has? All these are there. Now it's about which specialty is about brain or heart. Cataract surgery is what is most people taking up. So you should know. So you should basically decide on what is it that you want. Is it about cataract or refractive? Is it about retina? Is it about cornea? Is it about glaucoma? There are pros and cons for all. Okay. It is not that one is really good and the other is really bad or anything like that. There are pros and cons for all. Cataract and refractive, your market is very large. But, the more and more and more and more you do, there are going to be some troubling patients, and one or two troubling patients give a case means there is a little bit of a problem. In retina, the volume is a little lower, but these patients are yours for life. So they will keep coming back to you, keep coming back to you, keep coming back to you. So they accumulate. Whereas a cataract surgeon does not want to really see both eyes pseudophakia again and again and again. He will say, okay, now you don't want to come back at all. If you have a problem, you show the other doctor there. That is what he will say. Because for him, a new patient coming in is the guy who is going to give cataract. Whereas in a retinal practice, it is not like that. Cornea practice is also about refractive practice, but non-corneal trained people are all doing refractive surgery. So earlier, it is not like the corneal fellows can only train in refractive surgery or something like that. Anybody can do refractive surgery now. Anybody who can invest in a refractive surgery can also do refractive surgery. Again, glaucoma, neuro-ophthalmology, pediatric ophthalmology, plasty, uveitis. You have to think in your mind, what does your heart say? What is best for you in terms of what are your own strengths and weaknesses? That is an important thing. Again, what are you good at? What are you not good at? That is something that you have to basically again and again reiterate to get into it. So I told you about economics of ophthalmology, cheaper infrastructure and personnel in ophthalmology. Clinical care is much, much better than in a lot of other specialties. And in our maintaining consistency is much simpler in ophthalmology than in a lot of critical specialties. Improvement in non-clinical care is very important. Like ophthalmology patients who come into your OPD are basically going to sit, look at your waiting area, look at the TV which is there, look at the receptionist, the demeanor, the behavior. All those things are going to be put into scrutiny. Whereas a guy who is going to, having a cardiac failure or he has come in coma, he will not look at all these things. Here, he's just looking at whether his life is going to be saved or not. Whereas an ophthalmologist patient is going to look at a lot of non-clinical care areas. So everybody expects a business class experience. Well, increasing costs are there for all this. Increasing salaries to staff will occur. But reducing non-clinical care and increasing costs, all this is a little complex issue. You can't compromise on the clinical care that you give. You can't reduce the non-clinical care that you give. But the costs seem to increase every year. Every year, the salaries have to increase. The overheads are increasing. A lot of new, the old equipments are all gone. Now we have to get new equipments. So a lot of changes keep on coming. So Or you have to think about all of this. Can you do fellowship later? Once you start earning, it's difficult to stop. Even if you're an OPD doctor, okay? If you're getting 75,000 rupees, or if you're a spectacle shop doctor, you're going to two places. They're giving 40,000 one place, 35,000 the other place. You're earning 75,000. From this to go down to 20,000 a month to do a fellowship is going to be difficult. Right now, I think fellows are also paid more, but in many places, it is a little low. Economic needs increase with age, and learning ability reduces with age. All that is there. So if you want to denounce fellowship, there should be the clarity of thought. What are you going to do? See, unless you want to go to a very high academic, or you want to be this or that or this, your ambitions are very high, then you can denounce your, if you don't have all those ambitions, and if you want to settle in a small practice, you are reasonably confident about the common surgeries, and over time, everybody will improve. So then you can denounce a fellowship. What about outside Kerala? There are a lot of good opportunities outside Kerala. I mean, in North India or in Karnataka or in Tamil Nadu and all those places, there are very high volumes. And the number of doctors to patients ratio there is a little less than in Kerala. Pay is variable in different places. I think you have to think about it. Very nice, non-demanding people. Keralites are actually very demanding people. Problems may lead to manhandling. That is also there. The other extreme is also there. Most of them are very nice, goody people. But if they perceive that you have a problem, they will come and hit you down also. Understand the beauty of Kerala in terms of climate, the ignorance in people about their own. Like in North India, I went and asked one person, do you have diabetes? And he's asking me, what is diabetes? That is the sort of ignorance that they have sometimes in some places. Dust, poverty, all this is much more. What about Middle East? Fellowship wins hands down in a salary. So generally you go to Middle East for a salaried job, or you may start a clinic along with multiple doctors or with some financiers there, etc. Generalist wins hands down in the number of jobs. Okay, so there are a lot of petrol money job wars, which are basically reducing jobs and pays nowadays. And starting pay is much higher than what you get in India. Risky, because the police directly investigates the cases, and they may take your passport and you may be stuck in that country. The rules are much more stringent, and so people don't operate. And so most of them are into medical ophthalmology. What about US, UK, and Europe, etc.? If you want to go, you go early, because you'll have to spend about 10 years doing all this training again and again, probably right from internship, then some other training. Probably you will have to go the research way, because a clinical way into ophthalmology in US and Europe and all is very, very difficult. So you can get research fellowships. And after years of research fellowship, you can say that, you want to move into a clinical fellowship, and then probably you can move into a consultancy program. So it is going to be very difficult, but you have to start early. Africa was the India of 1980s. Unlimited opportunity to be rich, but lawlessness and its risks. So Africa is something which you can think about. Okay. Now I was thinking about talking to you about a lot of examples of people whom I know who are in all these areas, but I think I have spent enough time. Okay. We should think that change in the job market is the only thing. There is a huge change between 1980s to 2000 versus 2000 2020. And in the future, when you are going to graduate into ophthalmologist and then go up, there's going to be a huge difference in the job market, in the entrepreneurship, in all these things. There's going to be a huge change, and adapting to this change is going to be your forte. The immediate challenges would be sometimes lack of jobs and placements, because you should understand that about 7,000 doctors who are coming to Kerala each year after MBBS. And I don't know about the number of ophthalmologists, maybe about 150 to 200 ophthalmologists may be coming to Kerala each year. And there are not enough jobs for this 200 ophthalmologists. Lack of fellowship positions. You may have to, shift geographically wide, far and wide, lower pay packages, longer skill development routes. As I said, somebody who was good in training cataract in 2 years, the fellowship programs have ensured that you train in 4 or 5 years. and your family pressures and economic needs, they may be your responses may be, some people may be perseverant and they may break all this. Some people may think that, I should win. That attitude is there. I should win. I should be the best. That attitude is there. Some people have the attitude, no, I don't want to be the top guy or anything like that. I want to live, and I want to live a normal life, and I want to be, not so ambitious guys. Money now versus there are people who want to say, okay, I can wait. I will do reasonably well now. Let it come. But networking, team building, they are very, very important thing that you have to do. So you have to talk to people, you have to talk to your peers, you have to build a network. All that is very important. There are some people who are floaters, who works here in 2 years, then he moves here, then he moves there, then he flies out, comes back and settles here, then he moves to this place. So floater is not generally a good thing for a doctor. Okay. Just one word about ladies' perspective. I know that a lot of you are ladies. Marriage, pregnancy, childbirth, rearing kids, etc. Very, very important things in the personal front, which you have to do. It's not that men don't have to do, but despite that, a lot of men invest more time into jobs, and there are some times when women cannot actually invest time into jobs or fellowships when you are going through these personal, very, very important things. And balancing family, all these things are important for men as well as women. But when women tend to take it more seriously, and balancing family and job, proximity to your house, less of shifting around and transfers, and may need to follow your spouse. Maybe the spouse is going to some other place for a fellowship or for a training, and you may go there and you may not get a job there. A lot of problems like that. Okay, you may need to take breaks from job. You may require to have a supportive boss at work and husband at home, which is a very, very lucky thing to get. And sometimes some people may get a frustration of non-achievement because they may be the best students when they were studying in MBBS and post-graduation, but in the job side, they were not able to perform as well. There's a lot of frustration of non-achievement, and that will come into their behavior. And definitely fulfillment of family happiness. A lot of living examples are there around you. There are very successful women. Right now, our Kerala Society president is Dr. Meena Chakrabarti, a very successful woman entrepreneur. Vijayalakshmi Madam is a president of the Calicut Ophthalmic Society. All India Ophthalmic Society secretary is Dr. Namrata Sharma, who is again another academic giant in the field. There are a lot of living examples around you of women who have broken all these barriers and come up really well in life as well as in job. But luck is needed in life. So who succeeds today's job market? There's a lot of debate about this. Is it a generalist or a specialist? Okay, as there was a big study like this, the Illinois model. So what happens is, at some point of time, the specialists significantly improve in their value. But what happens is that the number of specialists also increase. As the number of specialists increase, as I told you an example of 1,000 cataracts, 1,000 retinal surgeries and 10 retinal surgeons versus 100 retinal surgeons. As the number of specialists include, their market rapidly falls down. But the generalists are not like that. They will be there. Their growth is not so much, but it is steady and it will be there. So generalization versus specialization, that is something that is going to come up in your times. In our times, it was specialization, which was very important, and we specialized, and we have most of us, like Sujit is a established corneal surgeon, like that, each of us have moved into our own spheres of activity, and it had paid at that point of time. Will it pay in the future? That is something that you have to, the change is what is constant, and you have to always keep on looking at what happens and plan your steps accordingly. Thank you very much. I think I had overshot time by some time.
No issues. It was an excellent talk. Sadiq sir, can you?
Yeah. It was a very nice and elaborate talk by Dr. Gopal. Thank you, Dr. Gopal. And one thing I would like to request the PGs especially is, along with your studies, try to do the International Council of Ophthalmology, ICO examinations, and also the Royal College examinations. ICO is the gateway to the Royal College, and this is the right time, your PG years as well as your fellowship days, you could do these examinations, and nowadays it is very easy to get the Royal College qualifications through the ICO route. Regarding the practice setting up, Dr. Gopal has very well described, and if there is any questions from the PGs to Dr. Gopal.
Feel free to ask. Please feel free to ask. Okay. And as I told, I probably won't be able to answer about your life. You have to decide. I can basically only tell I or anybody in this panel, whoever is a senior person in the panel, can probably weigh the pros and cons. And I think you should also have one guru. There is a relationship between a teacher and a student. A teacher teaches, the student learns. But a guru is not just a teacher. He teaches you about life. He handholds you through your life. And he talks to you about other aspects other than, the academic things as well. So it's important that you have a relationship like that. Whenever you go forward also, there will be a lot of people who will actually help you. Unless you ask for help, you will not know who is going to help you. That's an important thing. Yeah. I am ready for questions, if any.
PGs, you don't need to put it in the chat box. You can unmute yourself and ask directly. Somebody has put a question in the chat box. You can ask directly, please.
I think that question was asked to you personally, probably. I'm not finding it in my chat box.
Okay. The question was like, I think she has put it personally, she or he, but the question is for the panel only, like suggestion for some good centers to do fellowship.
Yeah, again, that depends upon what specialty you want to do versus are you willing to go a geographically long way away, or do you want to do near you? You have to be more specific, because where do I do a fellowship is a very, very diffuse question. There are a lot of cataract surgery fellowships. I think in Calicut, anybody is giving cataract surgery fellowships?
Comtrust is giving some, it's not fellowship. Vijayalakshmi madam can say more about it.
Yeah. So right from cataract to, there may be some centers, like if you are a senior resident in a medical college also, you may get a lot of cataract surgery. You may go to neighboring states like Arvind or Shankarai Hospital, or even Shankar Netralaya for a FACO. Ratan Tata fellowship is there. Then in the north, there are places like Chitrakoot, and which are high volume centers. So I think you will have to look at what you want in terms of the place where you want to do, and etc. etc. Yeah. What is the scope of a specialty like oculoplasty in Kerala? Yeah. All you young girls have to tell me what is the scope of oculoplastics. So I think plastics is also coming into be, like, for example, the patients in our times, the older people in our times are not really bothered so much about their appearances, etc. But that is changing very, very rapidly. And so any small ptosis, any small blemish, any small thing, they want to just remove it. So oculoplastics definitely is coming up. And oculoplastics, the other area is about cancers. The cancer numbers are not going to grow up like that. So cancer numbers, the retinoblastoma numbers, or the tumor numbers, the orbital tumors, they are going to be static. They're not very high volume or anything like that. So you should understand that plastics and all our areas, see, so you should differentiate between aesthetics plastics versus core plastics in terms of, ocular oncology and stuff like that. Aesthetics is going to burst forward. Aesthetics is going to come up in a real big way over the years to come. The ocular oncology bit of it is going to be static. Probably there are going to be newer treatments and newer medicines, etc., but it is not going to burst hugely. Aesthetics is going to come. What is the next? There are a few questions in the chat box. what is your take on doing diploma in hospital management related course? Actually, I did not cover that. Okay. One of the other opportunity that you can do that, slowly and slowly what is happening is the infrastructure requirements are increasing. The infrastructure costs are increasing. The HR costs are increasing. The HR needs are increasing. Patients' demand is increasing. And the remuneration, as far as insurances are concerned, government insurances are concerned, they are all depleting. This is not just in India. This is all over the world. All over the world. Remuneration to medical services is basically they want to somehow bring down the remunerations to the, but you should understand that in the US or in the UK or in some other places, it will be 20 times higher than our pay packages, which are basically reducing. Okay. But ours is also reducing. So many of the people see but many people take that binge just after MBBS. After MBBS, they would move to hospital administration, or they may go into the IAS route or IAS, IFS, IPS route, or they may go, I saw one person who moved into medical journalism. There are people who go into medical illustrations, artificial intelligence development. So that is something that has come. So let me tell you that one of the most important retinal surgeons in the world is Steve Charles. So do you know what he did? He is basically an aeronautical engineer. Okay. And this aeronautical engineer, at about 40 years of age, he decided that, that's not his thing. So he does medicine. Then he does ophthalmology. Then he does retinal surgery. And now he's the guy who makes the Accurus machine. He's the guy who makes the any new vitrectomy machine, any new technological development that comes in retina. He's the guy who is making. So that is what they think. They are not like us. We usually are bogged down by our 20s. By 25 years of age or 27 years of age, I have to finish studies. Now I have to start. They're not like that. They don't have that insecurity. And then so they learn, they shape their career as they go on. And there are people who join for courses at about 55 years of age, etc. So doing hospital management and related courses, usually after MBBS. Yes, after ophthalmology, it can be an add-on. But you see, many of the eye hospitals, the mid-level eye hospitals, are basically small ophthalmologists themselves will be, managing. And the larger corporate hospitals are the ones who require these managers. And definitely, yes, a doctor who has studied management will definitely have a place in those corporate hospitals. Does it matter if, does the institute do fellowship?
Jinchi, what do you want to ask? Like, I think the question is not clear.
Okay. She asked that, does the fellowship giving institution, how big it is or how small it is, will it matter? Yeah, it depends on what do you want to do. Okay. You want to start a small clinic, or you want to start a small eye hospital, or you want to be in job in an eye hospital where you want to be a surgeon. You want to train yourself in medical retina and come there. You want to train yourself in cataract surgery and come there. Or as you said, you want to train yourself in oculoplasty. If you want to train yourself in oculoplasty, probably there are not many centers in Kerala. But if you want to come back to Kerala and practice and all, actually it really doesn't make a huge difference where you do the fellowship from. Only thing is you should be adept in what you are doing. But in a larger place, you will have acquaintances with a lot of people who are the best in the world. So if you want to now go to Mayo Clinic for a super specialty in oculoplastics, or do you want to work with one of the top doyens in that particular field? Okay, like Jerry Shields. If you want to work with Jerry Shields, you can. If you are in a very large center, probably Jerry Shields visits there. You can have some time with that particular person. You can talk. You can ask. You can maintain that contact. So your contacts and networking can increase if you are in a larger place, if you are more ambitious. If your basic idea is to come back here, back to Kerala and do some work here, it really doesn't matter which place you did the fellowship, but you should know the job. I hope it is clear. And one more thing, my opinion may be completely different from Swadik sir's opinion, which may be completely different from Sujit's opinion. So these opinions are not to be, these are my opinions only. These are not some sacrosanct rule that this is the only way forward or anything like that. You can take it, but you can have multiple opinions from multiple people as well.
I think there's a question asking like, is it the FICO exam that we have to clear for practicing out of the country like Australia?
I think Muhammad Sadiq sir will be able to answer this question much better than myself.
Yeah, it is not the ICO. ICO is a reputed examination across many countries, but to practice in any country, for example, in Australia or in the US or in UK, you have to get the medical licensing in that country. And that is a different channel, and you have to appear for the, I hope in Australia, there is a different examination you have to pass and get the license there. And if it is UK, the channel is different, and it varies from country to country. And as such, ICO is not an examination for licensing in any country. Many of the job providers, they accredit ICO examinations as a valuable exam. And moreover, the Royal College examinations, the Royal Colleges, especially the Glasgow as well as Edinburgh, they have validated ICO as their equivalent to their primary examinations, and they give exemptions to their examination. And if you pass the ICO first three examinations, Royal College of Edinburgh, they will give you MRCS without any further examinations. And if you pass the advanced examination with 180 questions, you can just appear for the clinical part of the exam to get an FRCS. That's it. Otherwise, licensing part, it is not a valuable tool in any country, to my knowledge.
So can you give some tips to these people who would be, thinking of writing these ICO exams or the FRCS? Like, is there any training centers that's going on or any training sessions that's happening?
ICO examination, mainly the ICO has three basic examinations. Visual sciences is the first paper, then optics and refraction and instrument is the second paper, and clinical sciences is the third paper. And all these three, they are just MCQ type of examinations. And I don't know any training centers as such in India, but there are international trainers like Professor Muthuswamy. He has an online teaching, and likewise there are many other people who do the online coaching for the ICU examinations. And for the FRCS clinical examination, there are people who train. For example, there are certain structured courses in UK itself. It is a paid course, and people, the students, the PGs, they can opt for the course and book in advance and go for the course. It's like a 1 day program, 2 day program. And earlier days, Shankar Nethalana had conducted, but I don't know, I think they have discontinued that 1 week program for FRCS clinical exam. And I think Madhura Arvind, they also used to conduct some examination-oriented short-term programs for 1 week or so. I'm not sure whether still they are doing it. It was there. And in Trivandrum RIO, one of the consultant, one of the faculty member, he is teaching for giving training for the FRCS Glasgow examination. So likewise, there are many people who gives hands-on and clinical teaching for the clinical examination, OSCE examination-oriented programs.
I think, Sujit, we have 2 more questions which have come. Is the possibility of working in a medium care hospital and taking fellowship after 3 or 4 years on, if you are not concerned with the pay at that time, or is it better that we finish it in one go, now that we are in the flow of studies already? So I think it is always better to have have all these training in one go, because breaking can actually give rise to some other problems as well. Because once you break, a lot of times you will not be able to come back. And when you come back, your knowledge, you should understand that the pinnacle of your knowledge is when you are going to write your PG exams or your fellowship exams or something like that, as sir was just telling. So that is a point of time where you are at your zenith of your knowledge. And as in a good fellowship training center, the preceptors will want to take people who are really good, the best. So if there are people coming for interview, you will be asked to write an exam, and the best people you will take. So mostly, if you wait for 3 or 4 years, exponentially your knowledge will come down. And so at that point of time, you may have to, compete with people who are really good in the field. Now, there are some people who don't take older fellows. Like one of the questions was, is there any age limit for fellowship opportunities? So some of these people, the problem is when you are younger, you are malleable. And as people grow older and older, they become more and more rigid. And the malleability factor becomes a little more lower. So most of the people will prefer younger people. If there is a choice between a younger person and an older person, people will tend to take the younger person in. But that is all very subjective. It's very subjective. It's no, there's no, everybody may not be viewing at these things the same way.
A few more questions actually.
Diploma in ophthalmic holder in terms of future demands, fellowship versus secondary DNB. Okay. So if somebody, let me tell you that the Medical Council of India has been dissolved and the National Medical Commission has come in. But before dissolution, I think the Medical Council of India has almost now stopped the DO program. In wherever diploma is there, they have basically converted all those diplomas into MS programs. So the basic idea of the medical board is to do away with 2 levels of post-graduation. They want 1 level of post-graduation. But since DNB is running in a lot of places, and since I think the National Medical Commission is planning to give some educational courses like this to other institutions as well, I think the DNBs will definitely continue. But the diploma program will slowly dip. So again, it all depends upon what do you want to do. If you want to go up the academic ladder, then there's nothing like diploma and stopping. Probably you'll have to do an MS or a DNB and then a fellowship and then only move ahead. But if you want to start a practice near your home, actually that doesn't make a difference, because to start, it will make a difference. But once you start, once you have your patients, and once you are very comfortable with them, they are very comfortable with you. That is what brings more patients to you rather than your degree. So if you want to practice near your place, or your practice is what you want, then diploma. But if it is job that you want, job in a place in which there is an institution, there is an eye hospital where there is a job, probably the diplomas will be looked down upon as compared to the MS graduates or the DNB graduates. So you'll be paid a little. The entrepreneur always wants to give you lower, and they are looking at reasons how you can be given lower pay. And if you are diploma in ophthalmology, yes, definitely, yes, it will be a little lower. Now, regarding fellowship, after secondary DNB versus fellowship without that, it also again depends upon where you want to practice. As in, if you want to practice in a medical college, if you want to join a medical college as an assistant professor, a diploma won't suffice. Diploma is not good enough. You have to have an MS if you want to be, even in a private medical college or in a government medical college, you should have an MS in order to be an assistant professor according to the current MCI rules. I don't know if Medical Commission will change it or not, but according to the current rules, it is like that. So if it is in a medical college, definitely yes, you'll have to do a DNB or something like that. If you want to practice, again, if you want to practice a specialty, you can directly go for a fellowship.
I think for some students, there may be a conflict, whether they should go for a higher degrees, diplomas, degrees or fellowships and all. But from what Dr. Gopal has told, we can sum up like that. These are marketing things. You need all these things to get you into a better job or a better place. But you can survive only because of your skills. So we know many surgeons are there. Probably as students, you may not be knowing many surgeons who are nationally and internationally acclaimed, who are just diploma holders. So
I told you
it's
about
not,
Natarajan,
yeah,
who,
Dr.
who,
Natarajan,
who
Dr.
charges 5,000 rupees. He said this is what basically takes you forward.
So if there is no other question, I think we can slowly wind up the session. Any more questions? So thank you, sir. Thank you, Gopal, sir. Gopal, sir was my senior resident. He was my source of guidance when I started my practice or when I completed my PG. And even after that, even now and then, I approach him for guidance in various things. So I'm extremely happy that we got him today, in spite of his busy schedule. The talk was like his talk, I would say, was a very open-minded expression of his own opinions from his own experiences. And here's what he said, like the interpersonal relationship. He's one person who is in contact with almost all the ophthalmologists of India. So he's spoken to them. He has understand from their own experiences, and that's what we have seen or heard in this talk. Like at this stage, even I found this very useful, probably in my future, like how I should go about in my future. But I'm sure you will also find this useful. If some people may not realize the importance now, but when they step into the practice, they may go back and hear this in the YouTube again, like that day Dr. Gopal was saying this and that. So I would rate it as one of the best talk in this particular topic. Thank you so much, sir. First of all, thank you so much in joining us today and giving us such a wonderful talk. I also thank Dr. Swadik, sir, for giving us his opinions and suggestions about this foreign exams. And we are happy that an FRCS examiner is here right in Calicut. So all these PGs can utilize this opportunity to talk to him about preparing for these exams and all those things. Thank you very much, sir, for joining us today. Next is like my own teammates, Dr. Vijayalakshmi Madam. Yes, sir.
Dr. Sujit,
yes, sir.
Regarding the OSCE examinations of FRCS, if any of the PGs they want any guidance, they can directly contact me. I am at any time I am free to help them.
Sure, sir. All the PGs, I hope you might have heard it. You can contact Dr. Swadik, sir, for any help in these OSCEs or the FRCS or FIC related exam queries. Thank you so much, sir.
Sujit, I want to tell you one thing also. I had written an article in 2012, which is in the KGO, which is even now available, I think. So I think if they want to just go through that, it's a 2-page article in which they have basically looked at each of those things, what to do after PG in ophthalmology. Dr. Gopal,
I must frankly admit that that was the one article, the reason why I called you. So I came across that article and I thought you are the right person to talk about it. I have that copy with me. I'll share it in the PG group. So again, thank you for highlighting it. Next is like my own teammates, Dr. Vijayalakshmi Madam, Dr. Mihir, especially for taking all the responsibility of conducting the PG talks, and all my scientific committee members for supporting the academic activities of KOS. And I'm sure this support I'll continue to enjoy in future also. And finally, all the PGs, I must thank you all for the cooperation you extended to this PG program. Today we are completing the 6th and the final module of the PG programs. I hope that it was useful for you. We have not been uploading it in the YouTube for the last few meetings. And that's only because we wanted you to be present in the Zoom and interact. Now, in the next few weeks, I'll be uploading all the previous videos also. So it will be there for reference. Whenever you want, you can go back and hear from the speakers what they have taught you. So,
Sujit, you want to do the voting?
Yes. We have. I'm just coming to it. Before you all leave, we have a poll regarding that talk today, and a chance for you to express this thing. Now I'll share the poll on screen. You can vote. Is it coming on screen?
Yes.
There are 5 questions. You can scroll down one by one. I'll wait for 1 minute or 2 minutes, then I'll end the poll.
This is very user friendly, Sujit.
Yes.
This is very good. So you will immediately be able to get a graphical representation. Then it is
Yes.
absolutely beautiful.
Yes, I'm getting this. 14%
But
have
what
voted,
about
17,
people?
20% voted.
What about people who are in YouTube?
YouTube may not be able to vote, sir.
Mhm.
But this actually, the YouTube link I haven't shared to many. I've
Mm.
shared only the Zoom link.
But next week it will be
Next
votes from YouTube, no?
No, sir. Next week also it will be like through the link only. YouTube
see.
you can see, but only through the link. So I'll end the poll.
There's an option like Mentimeter, which you can do in YouTube also. You can
What is that?
do a
What is
poll. There's something called Mentimeter.
Yeah, that is
Mentimeter.
how postgraduates will. I hope Lakshmi is a postgraduate, is it?
No.
Sorry. sorry.
Is it like our own Lakshmi? Lakshmi
Yes,
C?
yes, sir.
Yeah, your face is not seen. Okay. So I'll catch you, Lakshmi, for that Mentimeter, whatever it is. We may need it for the next week's meeting.
Okay.
So
Yeah.
about 41
There's something
people.
called a Mentimeter. So you can, even if
Yes.
you're
Oh, ഇത് നമ്മുടെ ലക്ഷ്മിയാണോ?
Yes.
അത് ശരി. PG-യുടെ ക്ലാസ്സിലൊക്കെ ഇരിക്കുകയാണോ? What?
I just gotten to listen to your talk, sir.
Dr. Gopal, your talk was really wonderful. See, etra people are not only PGs, people are listening.
Madam, YouTube live ആണ്.
So I'm sharing the results. Let us see if you can see the results there. Can you see the results?
Yes.
Yeah.
63% wanted fellowship before your talk. More people wanted cataract. After your talk, specialty training first. Choice of institute, Shankara and Aravind, people prefer. So 100%, Vijayalakshmi Madam, special note, PG modules have been useful to them.
Yes.
So special thanks to Dr. Mehir also for conducting all the 6 modules without any interruption. So
Good to know. PGs have liked it.
Yeah. Not only liked it, 100%. I'm saying.
100%. Yeah.
On practice is 13%. Nobody for charity hospitals.
Sir, you have told them that you're not going to get any money from there. That's why.
Count your blessings. That will keep you going, no?
Sir, right now, I
Specialty
think,
training first.
Yeah.
Things have changed. Yeah.
So that's it. So let's conclude the meeting. I would request all of you to join KOS in our annual meeting next Sunday. The details will be updated in the group, in the PG group as well as the main group. So stay tuned. We expect you all for our next meeting also. It's going to be again a good, fun-filled, entertainment-filled event. So join us next Sunday. Thank you, sir. Thank you, Gopal sir and Swatik sir.
Thank you.
And thank you all.
Thank you all.
Dr. Gopal. Thank you, Dr.
Thank you
Swatik.
very much.
Good night.